When I saw her again 6 months later, I asked her, look, how is that taste? How is that burning mouth syndrome that you were diagnosed with by the maxillofacial surgeon? She's like, oh, it's gone, it's cured. I was like, how? She said, oh, I had hypnosis. I was like, what?
What they say is that everyone potentially can be hypnotized as long as you want to be hypnotized. Because if you're doing it because your wife or your husband or your kids are saying for you to do it, it's going to be very difficult. Things like just relaxation, it's enough, because people with chronic pain, they carry a lot of grief, a lot of tension because they've tried so many things. So sometimes just relaxation is, I'm not saying it's going to cure everything, but can be enough to improve their quality of life. She was a 10-year-old girl and she was so pleased because she was starting orthodontic treatment and she wanted that extra help because she knew that if she didn't stop, the orthodontic treatment wouldn't work. So that was very rewarding.
I've been fascinated with hypnosis and hypnotherapy. Do you remember that episode we did with Dr. Mike Gow? How powerful it can be. You can actually do implants without local anesthetic. That's what we've discussed previously. In this episode, we have a different angle, an update, because my ex-colleague, Dr. Rita Pais, we used to work together in Windsor, and I saw that she's now trained in hypnotherapy. So she's both a dentist and a hypnotherapist. And I was a little bit intrigued. And then I had a patient that had burning mouth syndrome. Interestingly, it came on after I carried out an extraction. And it continued on for about 6 months. And then overnight, just like that, it went away after she had some hypnosis carried out on her. And that really piqued my interest. So I reached out to Rita to let's help record something so that we can help our patients. Because I was thinking, if only I knew this was going to help my patient, I could have referred her sooner. And since recording this episode, I've identified a few patients that I referred for hypnotherapy to help them eliminate bad habits like cheek biting, for example. Sometimes that's a response due to anxiety. So instead of just observing it and noting it, we can now offer some advice to our patients for those that are keen to get that resolved or treated. Hello, Protrusive, I'm Jaz Galati, and welcome back to your favorite dental podcast. Now, every PDP podcast, I give you a Protrusive Dental Pearl. Today, I've combined something which I've probably given as a pearl before, the use of mouth props. But I'm going to deliver this pearl in a communication way. So how can we almost hypnotize our patients, if you like, or use careful language to help patients accept the mouth prop? I was recently teaching our bulletproof course and I showed some videos of me doing some quadrant dentistry, and what the delegates realize is that I'm regularly using a mouth prop. There's that little plastic wedge with like a little chain hanging out, which the patient bites into, thus keeping their mouth open for the procedure. I'm a huge fan of it. Having a mouth prop is like something I explain to my patients. I say to them, holding your arm out like this, like holding your arm out to the side, like imagine holding your arm all the way out to the side. After a while, your deltoids, your arm muscles start to hurt. Now imagine you're now leaning your elbow against something. How much nicer does that feel? You're able to rest or brace your arm against something. Well, it's the same with when we keep our mouth open for dentistry. We all have those patients that keep closing, their muscles get tired. Those patients, and to be fair, any long procedures that I've got rubber dam on, I like to use a mouth prop by default. What you absolutely shouldn't do is ask the patient, hey, would you like me to use this mouth prop for you? Because the default answer, especially in the UK, is, oh, no thanks, darling, I'm all right. And now the patient suffers and you suffer and your DA suffers. This is the way to do it. You say, Mrs. Smith, I'm going to use this mouth prop. It's like a little wedge. And what this is going to do for you is a bit like, imagine you hold your arm out like this, and I literally like hold it out so the patient can see. After a while, my arm's going to get a bit tired. Now, if I lean against something, that's so much nicer. It's the same when we're opening our mouths. Our jaw gets really tight and you keep wanting to close. So what I'm going to do, kind of like the elbow leaning against something, I'm going to give you this little wedge and you're going to relax into it. You don't need to clench on it or bite on it, just relax into it. This will stop you from getting tired. Now, of course, there's a benefit to us as a practitioner, but we don't need to go into that. Now, you could say, and it keeps your mouth open so I can do a lovely job for you without you having to work harder. So things like this, I pair the benefits. Now, the other thing which I think made a big difference in communication and acceptance of a mouth prop is the following. Guys, do this for me. I want you to all swallow with your teeth apart, about maybe 25, 30 millimeters. Imagine you got a mouth prop in place. So open your mouth and swallow. So lips apart, open your mouth and swallow. It's difficult, right? Yes, they have a mouth prop to brace their mandible against, which allows the swallowing reflex to happen. But the point is, it's difficult to swallow in a new position. It takes the patients a little bit of time. And I say to the patient, for the first 90 seconds, it's going to feel really strange as you teach your brain how to swallow again. Once you've mastered the swallowing, you'll be absolutely fine and your jaw will be ever so thankful at the end of the procedure. And that's it, guys. Please go ahead, buy some mouth props. These are absolutely imperative every time I use rubber dam. Patient's winning, I'm winning, my nurse is winning, and now you've been able to communicate the mouth prop in a way that you're going to get more treatment acceptance. Hope you enjoyed that. Enjoy the main interview, and I'll catch you in the outro. Dr. Rita Pais, welcome to the Protrusive Dental podcast. I'm genuinely interested. I have, as someone who's in the TMD space, I know I should know even more about hypnotherapy, right? And I'm just so excited to have found you because we used to work together. We used to be colleagues.
Yes.
Back in the day in Windsor, you're still there, which is great. Rita, tell us about yourself. How did you get into this space of hypnotherapy?
Well, to be honest, when I graduated 20 years ago, I had a patient that used to do hypnosis, and I was a little bit fascinated by it. But it just died and I didn't pay attention to that. And then 2 years ago, I met someone that was doing the course that I did for hypnotherapy, and she needed someone for case studies. So I offer, because I used to bite my nails, so I offer me as the case study for her. And I found it so interesting that I said, maybe I should go back to this again. Yeah. And that's how
it sparked that interest in you.
Yes, again. Yeah. And I like to do something. So yes, I'm a dentist, but I like the fact that I do something on the side as well. So, and if I can, join the two together, that's perfect. Yeah.
Well, something that we clarified before we hit the record button, just for my own, and everyone's probably thinking it, is what's the difference between hypnosis and hypnotherapy? And really, hypnotherapy is using hypnosis skills and tools for a therapeutic outcome, and in our case, health, right?
Yes, I would say that that's a nice way to put things. Yes.
And how does it compare to something like cognitive behavioral therapy?
Actually, what I do is cognitive behavioral hypnotherapy. So I use CBT techniques, and then I add the hypnosis so that we can make the treatment a little bit more effective, quicker results. So it just makes treatment more powerful, so to speak. Yeah.
And
so I do CBT, and then we add the hypnotherapy.
Okay. And when you deliver your hypnotherapy, is that in the dental clinic? Is that from home? Is that on Zoom? How do you deliver it?
I think there's not much of a point on doing in the dentist, the setting. Obviously, for something like phobia, dental phobia, there could be a time of treatment that it's interesting to do a little bit of exposure. But we can do everything online or in a therapeutic room, something like this. We don't have to do it in the dentist. We don't have to do it on the chair. Yeah, no.
When I reconnected with you on Facebook and I saw that, oh my God, Rita's doing hypnotherapy. That's so cool. And it was just amazing that I literally, the same day that I reconnected with you, my patient comes back to me. So here's a story with this patient, right? I took out a tooth, and then since I took that tooth out, she had this weird taste in her mouth, and she was diagnosed with burning mouth syndrome, right? And then when I saw her again 6 months later, I asked her, look, how is that taste? How is that burning mouth syndrome that you were diagnosed with by the maxillofacial surgeon? She's like, oh, it's gotten, it's cured. I was like, how? She said, oh, I had hypnosis. I was like, what? And she's like, yeah, she was skeptical at first, but she had hypnosis, and literally that same day it went. And so obviously everyone's different. It's difficult to ascertain, but I'm just genuinely fascinated what we can learn from this particular case study. So how does hypnotherapy work?
Well, pain. So pain is a very complex situation, right? And especially chronic pain. So these are people that have been suffering for years and they have tried a lot of things. Maybe not, I'm not so sure. Maybe your patient was not like that. I don't know if it was more of
I wouldn't say it's chronic. I'd say it's less than 6 months. It wasn't chronic, but it was still something that was affecting your quality of life and something that was present daily, which pretty much vanished very quickly.
Yes. Yeah. So that's even, probably this is why just one session was enough for her to improve. But there's a lot of things we can use with pain. It really depends on the person and on the particular situation. But sometimes things like just relaxation, it's enough, because people with chronic pain, they carry a lot of grief, a lot of tension because they've tried so many things. So sometimes just relaxation is I'm not saying it's going to cure everything, but can be enough to improve their quality of life. Other things like imagining the pain as a color. So almost like dissociating from the pain can be something that it's helpful. Mindfulness, exercises as in chronic pain people, they feel like they have no control over their pain, for example. And sometimes rehearsing and teaching them how to gain back control and reframe the way their negative thoughts around pain, everything can just make their condition improve. Obviously, we're not aiming for 100% cure. If people are looking for that, it's going to be very difficult, but sometimes even 50%, 80%, this is a very good result.
In the literature,
anyway.
you know, if someone's 8 out of 10 pain and you get them down to a 6, that is statistically significant in the literature, you know, when it comes to chronic pain. So I appreciate that very much. But, you know, look, here's my naivety, right? I think of hypnosis and I think of the going to the circus and the guy waving his golden watch, right? And this is the painting that people see, right?
Yes,
so
I know.
Can you tell us what contemporary hypnotherapy looks like?
Well, that still exists, and that's absolutely fine. That's stage hypnosis. So there is a role and a part in society for that, which is absolutely fine, fun, okay? But that's not really hypnotherapy or how we do it. But you are absolutely right. There's still that idea around hypnotherapy that you'll be clocking by like a chicken, or people will, you'll
you'll forget your name or whatever.
Yes. So there's a lot of things around that, but it's nothing like that. You're always in control. I cannot make you do anything against your will. You're never asleep. You're always aware of what's going on. If you open your eyes, it just, so there's a lot of schools of hypnotherapies.
I can imagine that.
I opted to go because I'm a dentist, so I'm always around science. So I look for something evidence-based. I don't want to use the word trance. I don't want to use unconscious minds because I think that's not part of my, my path as a dentist. So I avoid using those type of terms. And with this CBH, I don't do it. So basically, hypnotherapy is when you are focusing on one particular idea, your mind just becomes more responsive to the positive suggestions that you will hear. Obviously, these suggestions are planned together. So I will not, even if I say something that you don't agree, it's absolutely fine. It's not going to make anything to you because you don't resonate with that. So it's not going to harm you because you don't feel like this is right for you. So basically, it's similar when you are very absorbed reading a book or watching TV, that's almost like you forget what's around you. Even if let's say your son talks to you, it's almost like you are not listening to that. That's a little bit how it feels to be hypnotized. So yeah, I'm not so sure if I've answered your question.
No, you have it, because that's what contemporary hypnotherapy looks like. It's like a talking therapy. You give suggestions. And so, look, when I've had my TMD patients, right, many have tried it and said, oh yeah, it helped a bit, or some patients it didn't help at all, and other patients it helped a lot. So were you taught any guidelines in terms of like, if I did a post-crown, right, I'm going to pick someone for case selection, someone who's got a feral, someone with good gingival health, that kind of stuff, low lip line. Have you found any way to screen patients? And the reason I'm asking this question is, as dentists listening to this, how can we find the patient who may benefit from hypnotherapy if they haven't tried it already? And how can we find someone where actually they might not be a good candidate? Or is everyone a candidate until they've tried it? Like, how do you ascertain that? I think everyone, obviously, there are contraindications for hypnotherapy, like everything. But let's say you're not psychotic, you don't have schizophrenia, you don't have a severe case of anxiety, or, everything that is severe, normally there are other things that need to be done first, not hypnotherapy. But let's say you are a mild case of anxiety, habit, everyone in principle can be hypnotized. Even if you're struggling, there are hypnotic skills training that we can do with you. So everyone can be hypnotized. Yeah.
Yeah.
And what kind of help have you given to patients, or what kind of like cohort of patients? So pain you mentioned, but can you give us some like examples of patients that you've seen that have had some sort of a benefit from hypnotherapy, so we can understand selection criteria,
Yes.
referral criteria?
So I think in dentistry, obviously, when we think about hypnotherapy, is phobias, right? Needle phobia, dental phobia. Obviously, you can, most of the times, maybe you can work around these situations without using hypnotherapy. But if the patient is willing to try or wants extra help, it works really well. Obviously, it's very important, the motivation of the patient and their expectation. So we really need to work on that, or they really need to be motivated to try hypnotherapy as a way to overcome the dental phobia. Yes, that can be helpful. Habits, for example, clenching the teeth, grinding. With children, I work a lot with thumb sucking, tongue thrusting, lip. I've done with a boy who was always licking their lips, biting your cheeks, and things that, nail biting, anything that can be these mild situations of habit, we can.
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and it's built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive Guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode. So like you said, clenching, grinding, like awake bruxism is a huge problem, right?
Yes.
It's a huge cause of facial strain, muscular pain. So that makes sense that you can actually give some suggestions and get patients to take control of this habit, a bit like nail biting, right? Patients clenching together during the day, putting their jaw in unusual positions, causing strain on their joints. That's a good one. And then cheek biting, you say?
Yes, yes. Every these type of little habits that people do it with the mouth, with the hands, nail, even skin picking, air pulling, these little things can be treated with hypnotherapy. Even CBT. I mean, actually for habits also, we don't need to use a lot of hypnotherapy. A lot of the protocol is around CBT, but yes, hypnotherapy can be introduced and can potentiate the treatment.
Are there any accepted traits of a non-responder? Like, for example, is there any data so that, okay, we took 100 people who had no response and we found that they all have a certain type of personality or they have certain type of beliefs or anything, or do we not know anything about that?
I mean, there's a couple of studies, but it's not clear because what they say is that everyone potentially can be hypnotized as long as you want to be hypnotized. Because if you are, if you're doing it because your wife or your husband or your kids are saying for you to do it, it's going to be very difficult. You have to be willing to try, to be open to try. Otherwise, there's no point.
Okay. And I think the dental indications here were brilliant in terms of, okay, awake bruxism, cheek biting, dental phobia being a good one. When we're looking, because most dentists don't offer this service, and when they're looking to refer to someone, what should they be looking for as someone who may be able to help their patient? And what do they say to a patient to help them get on board and manage expectations and how many visits it might take?
So, for example, for habit reversal, it can be done in maybe 3 sessions, or even in a longer appointment, it can be done. For phobia,
how long is a session?
Well, if it's just one session, around 2 hours. If we do it slowly, we can do it like in 3 sessions, 1 hour each session. Sort of, yes. And again, like I said, it can be done online. You can do it in person, but yes, you don't have to. You can do it online. It works the same way. With phobias, it takes more time. It can take up to 6, 8 sessions, depending on the case. So I would advise people, my advice is if you can join CBT and hypnotherapy, great, because I think that really is almost like you get both worlds together. And so this would be my advice, to look for someone that does CBH, because we have the benefit of the hypnosis and the techniques from CBT.
What is the person that you go to sleep feeling proud that, wow, like sometimes you do a case in dentistry and you're like, wow, I managed to save that really broken down molar. We got a crown on it. The patient's still chewing on it 5 years later. You feel proud. Have you any cases whereby you felt proud of the hypnotherapy that it was able to have this amazing result for a patient?
Well, so I work with children as well, and with habits that's really helpful. So recently was a scum sucking. She was a 10-year-old girl, and she was so pleased because she was starting orthodontic treatment, and she wanted that extra help because she knew that if she didn't stop, the orthodontic treatment wouldn't work. So that was very rewarding. And with kids, so nice because we use their imagination, just preparing the sessions all around what they like. And she liked Mr. Bean, so we introduced this in the script. So it was really rewarding. That was the latest one I work with in terms of habits. But whenever you see that someone is, just improving just a tiny little bit, it's very, very rewarding. It's very, very rewarding.
Yeah, thumb sucking is a huge one. We see it in a lot of our patients, and they try their best. But we want to if you get it early enough, before age 8, if you get in before age 8, then a lot of the dentoalveolar changes reverse and they improve. And the longer you go past age 8, the more permanent those changes become. More likely to need orthodontics. And prior to then getting orthodontics, they need to have that habit reversed anyway. So that's a really good indication. And any others? I'm trying to give dentists more ideas of when they've tried some advice, but the advice is not working, when else could they consider hypnotherapy, which is like a minimally invasive talking therapy, which makes a lot of sense?
Well, like I said, any habit can be used. Phobias, pain. Again, pain is special, but another thing is to help ourselves because we do struggle with a lot of stress. And so I've had a few clients, patients, dentists that needed the help from, maybe someone that knew what they were going through and then just help them with this stress, anxiety around dentistry. So that's another thing that it's quite helpful as well.
Very good. Very good point. How do you find someone? So if dentists who are listening, they found a patient, maybe a thumb sucker or some sort of habit or stressful or awake bruxism or chronic pain, right? Especially like TMD and stuff. Where is it good to find someone? So for example, for physios, TMD physios, there's like a website where people have registered ACP TMD, where specialist TMJ physios have registered. Where is a good place to find a trusted hypnotherapist?
Well, there's a lot of places. I'm not so sure about if everyone is the right person or not, okay? Because there is regulation, but there's a lot of regulators. So it's difficult to say where is the best place to find someone. But there is a website called the Hypnotherapy Directory. But again, anyone can be on that. So all types of hypnotherapy. So it's difficult to say where's the best place to find.
But let's say you're a dentist listening in Manchester, Birmingham, Scotland, Minnesota, Adelaide, whatever, and you find a patient and you listen to this podcast. Hey, Rita, that sounds very interesting, and I want to help my patient. It may be just a quick Google, hypnotherapy near me, to help find your patient and maybe build a relationship with that hypnotherapist to help serve your patients. But is there anything they need to look out for in terms of, okay, well, this person has got additional qualifications or this kind of trait or something to avoid or something?
I would look for someone. Well, from my point of view, I like the fact that it's science-based. So I would look for something, again, I don't like this idea of trance or unconscious or anything like that. So this is something that me as science person look for. All right. So this is my preference. So I would look for someone that has some sort of science-based background. There's a lot of people doing that anyway. So this would be my.
That makes sense. So someone who has more respect for evidence base.
Exactly. Yes, that would be my approach and my advice. Yes.
Let's do, for the final bit of the podcast, let's do a mock session. Rita, I bite my nails. It's a bad habit. Let's say we book a Zoom and you're going to help me. So just tell us about the whole patient journey. What our patients can expect. And so what the dentists are learning here by doing this little mock scenario is just getting to understand a little bit more about, okay, what my patient can expect.
So obviously we would do the medical history, and then the first bit that I would work with you is understanding when you do the habit. All right.
Driving.
So awareness is the first step. Okay. So when, how often do you do anything along with the habit? Because sometimes we bite the nails and then we pull the hair, or we do things together. And I would advise you to have a habit diary where we would write down, oh, I did the habit there for I don't know how many minutes, if you can, obviously. And then I was feeling stressed or anxious. I was thinking, oh, my life is so difficult. What you were thinking, any early warning signs, because sometimes we start, let's say with nails. First, we start by, oh, let's try and see if there's any jagged nail or there's anything I could pick. So these little things are all important for us to find how we perform the habit. So that would be the first step, the awareness. Okay. With any habit, this is the first step, is when we are performing. And then we would try to find a competing movement. Let's say you bite your nails, like you're saying, right? So you bite your nails. So you bring your hand towards your mouth. So a competing response could be close your hand into a fist and just pull your hand down. Because if you do that, you won't be able to bite your nail. So we always try to find the opposite movement to what you are doing. Let's say you are licking your lips. One opposite movement could be rolling your tongue to the back of your mouth, for example, something like this, so that you're not able to do both at the same time. So another thing we do then is to try to come up with something for you to say to yourself. But it needs to be meaningful for you. For example, I can do this, I've got this jazz, or something that you can then associate with the contra habit in a way, okay? So that you can do everything at the same time.
It's like a pep talk.
Yes, pep talk yourself. Yes. Something that you would say to yourself. And then we would practice this, kind of like performing the habit. So you will go through in your mind. So you said you were biting your nails in your car. So you would say, I'm in my car, there's traffic, so I'm getting bored, I'm getting stressed, so I'm going to raise my hand. And then you would do the habit, pulling your hand down, think to yourself, you've got this, Jazz. So this is what we rehearse in sessions. This is very important to try to motivate you. So we would try to see what are the benefits of stopping the habit, and we will list the benefits. What are the problems of carry on with a habit, and we would list this. And then I would try to help you find a buddy, like a habit partner, so that you have someone next to you that can say, oh, Jazz, you're biting your nails, or Jazz, don't forget to practice your things. So it's important to have some, and it's not someone that will nag you about this. I don't want anyone to say, please stop. It's it's not nice. It's not hygienic. You have to be someone kind next to you to help you stop the habit. And then you have to practice this a lot. So you have to do a lot of homework and practice.
I love that, and I'm glad I asked this because it gives me a deep insight into what you do. And what I took away from that is very bespoke to the individual and their circumstance. Yes. And so that I really appreciate that, actually. Amazing. Rita, you've answered all my main questions about hypnotherapy. I'm so excited to see you develop into this new role. Tell us about how you serve patients, where people can find you, dentists can find you, referrals, all that kind of stuff.
So I'm working in Windsor and Marlow as a dentist, but like I said, we can do this online easily, so that's not a problem whatsoever. Obviously, with children, it's nicer to be in person. So normally what I do, I rent therapy rooms, so I can relatively mobile, so I can move around. That's not an issue. And this is how I see my patients. Yeah.
Have you got a website that dentists can check out?
Yes, I do. So it's my name, www.ritapais.hypnotherapy.com. And then I have my Instagram, where I try to post a few things about hypnotherapy, how we can help, some little tips. So that's at Rita Pais Hypnotherapist. So I think.
Amazing. Well, when I have my awake bruxism patients and TMD kind of stuff, I'm gonna check out your website, and I'll put that in the show notes. Rita, thanks so much for allowing us to understand what is contemporary hypnotherapy. Example of using me as an example, and some case examples that we discussed, so that we are better informed for our patients that we serve day in, day out. Because as a GDP, we have this more holistic approach to our patients, and thinking that, okay, like my burning mouth syndrome patient, I never thought about that. Had I known, I could have been the one to suggest, hey, have you tried hypnotherapy, for example? Or patients who are clenching a lot during the day, or thumb suckers. Instead of recommending chili on the thumb, I could say, hey, have you tried hypnotherapy? And it's another mode of care that we can prescribe to our patients, listening to their values, and in a minimally invasive way. So thank you so much for your time.
No, happy to be here. Thank you.
Thanks so much. Cheers. Well, there we have it, guys. Thank you so much for listening all the way to the end. This is a CPD eligible episode. If you're watching on Protrusive Guidance, scroll down below, answer the quiz, and our CPD Queen Marie will send you your certificate. If you're not already on Protrusive Guidance and you're a regular listener to the show, you are totally leaving CPD on the table. Look, we're pretty cheap. We're not an expensive CE. We are the best value subscription in dentistry. And the first step to take is just visit protrusive.co.uk/ultimate. We have members from all over the world, and truly the nicest and geekiest dentists in the world. I want to thank Team Protrusive, who work tirelessly to produce now pretty much averaging 2 episodes a week. So the team has grown, we have more capacity now, and it's an absolute pleasure to be able to record these podcasts. Thanks to you guys, the supporters of Protrusive, whether you've been with us on YouTube and Spotify from years ago, or more recently on the Protrusive Guidance app. It means so much that you enable us to record these episodes and the clinical videos that we make. Problem is, though, there's still so many people who've never heard of Protrusive Dental Podcast. So please, if you enjoy this episode, share it with a WhatsApp group that's full of dentists so they can check out what we do. I want to thank you again. I'll catch you same time, same place next week. Bye for now.